Thunderstorm asthma is a serious and often underestimated health risk that could pose an increased danger to allergy sufferers and people with respiratory conditions in the coming days. The combination of thunderstorms and high pollen levels creates a hazardous environment where even individuals with no history of asthma can suddenly experience severe breathing difficulties. Experts warn that this phenomenon is not just an isolated occurrence, but can lead to mass cases of respiratory distress in regions with high pollen exposure. What makes thunderstorm asthma particularly alarming is its unpredictability. Many people are unaware of the risk until they experience symptoms themselves. The underlying mechanisms are well documented. During a thunderstorm, strong winds and sudden shifts in atmospheric pressure cause pollen that was previously floating in the upper air layers to be rapidly pushed down to ground level. These pollen grains, which are usually too large to penetrate deep into the lungs, break apart due to high humidity levels. As a result, microscopic allergenic particles are released into the air, small enough to infiltrate the lower respiratory tract. This can trigger sudden asthma attacks, acute shortness of breath, and, in severe cases, life-threatening allergic reactions. What is even more concerning is that not only asthmatics are at risk. People with seasonal allergic rhinitis, commonly known as hay fever, are also highly susceptible to severe respiratory reactions when exposed to high concentrations of these allergens. Studies indicate that many individuals who have been hospitalized due to thunderstorm asthma had never been diagnosed with asthma before. This suggests that the risk is widely underestimated and that many people are unaware that they need to take protective measures. The situation is especially dangerous for those whose asthma is poorly managed or uncontrolled. If the airways are already inflamed or irritated, exposure to these allergenic particles can amplify the inflammatory response, leading to full-blown bronchial spasms. In the past, thunderstorm asthma events have overwhelmed entire cities with a sudden surge in emergency cases. One of the most notorious incidents occurred in Melbourne, Australia, in 2016, when thousands of people experienced breathing difficulties within just a few hours, resulting in multiple fatalities. This risk should not be taken lightly. Those who suffer from allergies or respiratory conditions should take extra precautions during thunderstorms. Experts strongly advise staying indoors during high-risk periods since allergenic particles can reach dangerous concentrations outdoors. However, even staying inside is not a guaranteed safeguard. Strong storm winds can carry these microscopic particles through open windows or poorly sealed doors, exposing people to the same threats they would face outside. To minimize risk, it is crucial to close windows and doors before the storm hits, use air conditioning systems equipped with pollen filters, and avoid ventilating indoor spaces until after the thunderstorm has passed. For individuals with known respiratory conditions, keeping emergency medication readily available is essential. Asthmatics should have their rescue inhalers on hand at all times and use them at the first signs of breathing difficulties. Taking antihistamines in advance may also help reduce the severity of allergic reactions. Anyone who has previously experienced sensitivity to pollen should pay close attention to weather forecasts and monitor thunderstorm warnings over the next few days. Rising temperatures and changing climate conditions could make thunderstorm asthma a more frequent occurrence in the future. A prolonged pollen season and shifting air patterns are likely to increase the spread of allergens, meaning the risk is no longer confined to specific geographic areas. Even those who have never suffered from respiratory issues before may find themselves increasingly vulnerable in the coming years. A major problem is the widespread lack of awareness about this phenomenon. Many people unknowingly expose themselves to the highest pollen concentrations by being outside at the most dangerous times. This makes it all the more critical to raise public awareness about thunderstorm asthma and encourage precautionary measures. Those who understand the risks can take steps to protect themselves, but for those unaware of the danger, an unexpected thunderstorm could have devastating consequences.